For years, we went there for youth sports competitions and collectors fairs, but it turned into a beacon of hope on the harbor through this pandemic. And while there is still a long way to go, tonight the folks who made the field hospital at the convention center possible took a moment to look back at what they've done so far. WMAR 2 News' Eddie Kadam shows us how an ambitious idea to handle an unknown surge evolved. Eddie.
Yeah, Jamie, over 3,000 people have been working on the front lines here at the convention center to transform it into a place first for people who got sick, and then a place for people to get tested, and now a place for people to get vaccinated, and still all of the above. The first COVID death in Maryland, mid-March of last year, and the first in Baltimore City 10 days later. More than 900 Baltimoreans and 8,500 Marylanders have died from the virus.
Each one is a name and a narrative, a story interrupted, and loved ones left behind by this devastating disease.
This field hospital was set up to handle an unknown surge during uncertain times as a hospital, testing, and eventually vaccination site.
This is a national model. We took the 250 beds. We didn't ask for the comfort. We didn't ask for 3,000 beds. We weren't about show. We were about substance. And that's what you have done. You've kept this thing going, and we're just coming out of our fourth wave and in all of the uncertainties.
The field hospital is a collaboration of Baltimore's two renowned hospitals, Johns Hopkins and University of Maryland Medical Center. The task for this group was to plan and deliver a 250-bed contingency hospital to care for COVID-19 patients. A year later, the leaders of those hospitals thanked the people who made it happen.
You have chosen to lean into this fight and demonstrate what we can accomplish when we lean in together.
So our coming together really was around serving our community, and you all came together as a team in a very powerful way to help us save lives.
The space has evolved and changed with the needs of the community, administering over 103,000 tests and looking after over 1,400 patients, administering antibodies to more than 2,000 people to treat COVID, and now putting over 100,000 vaccines and counting into the arms of people who need them.
We've published 5 studies in physical therapy, in contingency healthcare, in infection prevention, in recruitment of physicians to such an event as this. And our prospective rapid antigen test, the largest prospective study of assessment of COVID diagnosis in our country.
And even though we're riding on the downward trend of the current wave and vaccinations are only going up, the people running this facility say they don't plan on closing it down anytime soon. Live in downtown Baltimore tonight, Eddie Kadam, WMAR 2 News.
All right, Eddie.